Good afternoon, everyone, and welcome to today's Facebook Live. I'm Diana Roya, Assistant Director of Communications and Public Affairs for New York City Health and Hospitals, Jacoby and North Central Bronx. Thank you for joining us during this last day of Gun Violence Awareness Month. Today, we're going beyond the headlines to have an honest conversation about something that affects every neighborhood, every family, and every generation: gun violence as a public health issue. When gun violence occurs, the impact doesn't end when the camera is gone. However, it affects survivors, families, children, first responders, healthcare workers, and the entire community for years. At New York City Health and Hospitals, we believe prevention, education, and healing all go hand in hand. Throughout this discussion, we encourage you to ask questions in the comments, and we'll answer as soon as we can. So let's get started. Of course, we have our lovely panelists, and so if you can just one by one introduce yourselves, let us know where you're from, and what is really important about your job.
Thank you for having us. My name is Eddie Miranda. I'm the program manager for Jacoby Hospital Stand Up to Violence. I'm a New York kid, born and raised in Queens, New York, moved to the Bronx about 16 years ago. I dedicated my life to working in our communities, to work against gun violence and violence in our communities. That's my story.
Praise and good day, Pastor Kwame Thompson, program manager, director of compliance at SUV Stand Up Violence at Jacoby Hospital. Born and raised in the Bronx, County Projects, and what's the other question?
What is important about your job?
To be a part of the solution to a problem that has been plaguing our community for so long. I think to help empower people to understand that gun violence is 100% preventable, and give them the tools and the hope to know that we can do something about it.
Hi, thank you for having us. My name is Dr. Romo. I am the medical director of the Stand Up to Violence program, the medical director of New York State Hospital Violence Prevention Programs, and also the division chief of pediatric hospital medicine here at Jacoby. I'm originally from East Los Angeles, but I've been living now in New York for over 23 years, and actually trained here in the Bronx through medical school and residency. And now came back as an attending, and I spent 2 years over in Washington Heights, New York Presbyterian, but most of the time has been spent here in the Bronx. And in terms of what's important about my work, obviously I have multiple roles that I play, but I think it's always kind of been one of my life purposes to really bring the victimization of violent trauma to the forefront as a public health issue and as a problem that should be addressed by not just one sector of the society, but all of society. I think it's really tragic that gun violence is the leading cause of death in children, and it's something that's going to take a multidisciplinary approach.
Thank you for having us. My name is Jonathan Kimball. I'm an outreach worker with SUV Stand Up to Violence, born and raised in the Bronx, in Soundview houses. And what's important to me about the work is that my community gets to see someone from their community making changes. That's important to me.
All right. Well, I guess we can get started with the series of questions. So how is gun violence actually a public health issue? And I'll open it up to the floor to any of you to answer.
Well, I think that, like I mentioned in the introduction, firearm-related injuries, leading cause of death for children under 18 years of age, is the leading cause of death for young Black and Hispanic men under 24 years of age. And it is a devastating epidemic, I would say, that's disproportionately affecting our Black and Hispanic communities, in particular for Black and Hispanic men. And there's actually been more casualties on U.S. soil from firearm-related injuries than there has been in every single conflict that the United States has fought in the 20th and 21st century. So there's been more fatalities here on U.S. soil than there has been abroad from firearm injury. And I think that's something we need to grapple with as a society. And it's not just mortality, it's not just death. I think when people are injured, there is a series of not just injuries that they have to deal with for the rest of their lives in terms of physical health, but also significant mental health issues that remain, along with the significant impact that it has on communities in general of living in environments where violence is normal.
To add to that, just looking at the effects that gun violence has in our community, comparing it to the way diseases play through our community, right? So you have the direct injury, death, the mental, emotional impact of it, the cause effect of violence in the community, and then understanding how we deal with it now. Like we have a public health approach to gun violence, right? Interrupting the transmission of gun violence, identifying and changing the date of the highest potential transmitter, and changing group norms, the same we would do with any other disease that plagues our community. So being aware of that allows us to know that there is some preventative measures that we can take in our community, but seeing the effects throughout the community.
And again, piggybacking off of what my brothers are saying, it just like anything, any disease that we deal with, we have follow-up appointments. You have, continuously are trying to get those resources to help you with that ailment, and that's the same situation that we have in our communities. What is being done when violence does happen in your community? Do we just leave it at that? What are the follow-ups to that violence? And how can we come together as a community to stop that violence?
So when someone survives a shooting, what are some physical and emotional challenges they continue to face long after leaving the hospital?
Well, as a victim of gun violence, some of the challenges is fear. Walking back into your community as a victim, feeling weak, the mental trauma. Are people judging me? Is someone going to try it again? All of these things consume your thoughts, and I encourage mental health support. SUV is able to be boots on the ground to provide that help, that trauma support, to provide those resources, whether counseling, therapy, just breaking bread, having a meal with someone, just to have a conversation. We're able to do that.
Yeah, I think part of the reason I think why SUV was started, why I've been involved with from the beginning, is the recognition that the treatment of violent trauma doesn't stop once a patient leaves the hospital. It's the idea that we can always do more, and that patients continue to face challenges after discharge that often go unnoticed and often go untreated. I think one of the major things, as was mentioned, is the fear of re-injury, right? The fear of even having thoughts of retaliation, right? Of hurting somebody else. And how Kwame mentioned how that fear can spread to you hurting somebody else, to you getting hurt, putting yourself in the position. And what we can do from the public health sector to identify those issues and treat those issues, right, is to help prevent re-injury, to help prevent retaliation, to try to support patients when they get discharged in the recovery, not just their physical recovery, but their mental recovery, their emotional recovery, and their social recovery, right? Is how do you reintegrate yourself back into society after another human being threatened your own life? So how can you move forward in your own normal life, going to work, taking your kids to and from school, going to a restaurant with your kids, going for ice cream? It seems simple enough for us. It's not that simple when you've already been injured, when you're always looking behind your back and wondering what will happen next.
And it's important to also mention, like, a lot of times when people associate victims of gun violence in our communities, they often think that they're involved in something, right? But we find that a lot of times there are a lot of innocent bystanders, innocent victims involved. I have to go back to that community that was shot. They have no idea what goes on in that community when it comes to different activities that can lead to violence. How do they cope, right? How do they feel comfortable with their families still being in that community? So there's a lot of different effects that take place that we have to be mindful of.
So how does gun violence impact parents, siblings, children, and even caregivers.
So absolutely, this we see it every single day, and it's why we work in the communities that we work in, because gun violence affects our everyday life, right? It affects a parent. A parent already has the pressures of society, the pressures when it comes to raising their children and keeping their family safe. So financially, they already have that struggle and that burden. So to add on to that, the fear of your children leaving the home, not knowing they're going to make it home that day. Again, that's a reality that we live with in New York City. Sending your elderly family out into the community, you can't guarantee that they're going to come home safely that night. Or even as a parent, sending your children to school, the trust that takes. Because again, mass shootings in schools isn't prevalent here, but walking from the school home is, right? That's where the danger is for a parent and the fear that they live with. We see it with even the local business owners, right? It affects the way they carry their business. It affects the way they're able to go out every single day because, again, they don't know what violence is going to be waiting outside those doors. So that's how it affects our communities. And even those that do not have families, again, just walking the streets of New York right now, every single day, it's not guaranteed your safety. That's something that we live with the community, and that's what we try to tackle with every single day with SUV, trying to bring that information out to the community and see how we can come together to lessen those stresses.
I think it's almost impossible to fully describe the effect of community violence as it is transmitted from family members to friends to just communities at large. But just to give you a sense, as you know, here at Jacoby, we're level 1 adult trauma center, level 2 pediatric trauma center. So we do see, unfortunately, a lot of the victims of violent trauma here in the Bronx. And when people ask me this question, this moment that sticks with me, was a patient that came in who was shot, who was killed, and whose wife was here. And when I told her that her husband had died, her only question was, this is the middle of the day, was who's going to pick up my daughter from school? He was supposed to pick her up, and now I'm here and I can't leave. So just think about that for those of us that have kids, right? Our lives revolve around drop off at school, pick up at school, coordinating that. Is not having that simple other person there to depend on, right? Having to think about now who's going to pick up my kid from school, right? It's that simple, it's that granular, that woman lost her husband, that woman lost her partner, that woman lost the caregiver for her children, that woman lost the person who's supposed to be there for them to help guide them to just pick them up from school. It's something we take for granted every single day, and that people have to grapple with and deal with every day when that person is no longer there. And the impact that a father not being no longer there for that child, not just not pick her up from school, but just to be there as a parent, right? What are the long-term effects of that on that child? It's almost immeasurable, but it's something that it definitely is very impactful. It has some very, very deleterious physical and mental health outcomes on children and communities.
I just wanted to add on a street level, the snowball effect that gun violence has. There's a kid 15 years old right now holding a gun, waiting to shoot somebody from a beef that started almost 30 years ago. The snowball effect to where a shooting happens in the neighborhood, now this person wants to retaliate, now that person wants to retaliate, and that continues on for years. So a kid who wasn't even born when this shooting took place is now engaging in a shooting for retaliation from when that started. And that affects everyone in our community, nonstop. So when you ask a kid, why are you shooting? Or where's the trauma? He shot my man. Who? 30, 40 years ago, and he couldn't even tell you his name. So it definitely affects the community on a snowball level. Yeah.
So speaking of mental health, how can we reduce the stigma and encourage people to seek help?
I'll address that again. Again, being someone who's been a victim of gun violence, all of the things that I addressed from the fears and all of that stuff. Shout out to my mentor, Mr. Kwame Thompson. I do the work because he came back for me. He came back, he encouraged me, he supported me, and I try to do the same for my community. I would dress when I got shot. If they're able to see someone who looks like them, as we call it, credible messenger, come from where they come from, talk the way they talk, and see that person make changes or blaze a new trail, they're able to be inspired by that. As you see from the panel, a lot of us have been through things. So when our community are able to see someone who looks just like them, or talks like they talk, they become a little bit more comfortable with expressing themselves. And then I'm able to have the conversation on how that has benefited me, how being a victim of gun violence and now being a credible messenger, I went through all of these things, talking to someone, getting mental health help, seeing a therapist, and here we are now. And so, I just try to be the change that I want to see and that reflection in the community.
I think Jonathan said it best. It's about normalizing these conversations that we're having in the community. And the way we do that is by having men like Jonathan that live in the community, are invested in the community, and have shared experiences that they can talk about it, right? It's about continuously showing up and being there when everyone else leaves. Our stories stay. And how do we get those stories out? By sharing it continuously, like, our fantastic credible message work there.
And part of normalizing, there's a statement that went around, I think, helped push us in the right direction. And it is simply saying, it's okay not to be okay, right? Because in our communities, we can't tell anybody that we're not okay, right? Like, I'm all right, all is well, it's all good, but it's not. So I think once we start identifying that we're not okay, and then having credible people in the community that went through that step first and then went to get help, and share that information, like, listen, I go to therapy. You know what I mean? And it's helping, right? And every therapist might not be for everybody, but go and find out which one is for you. So we started normalizing that amongst ourselves and amongst our community. So it goes from, it's okay not to be okay, but now it's okay to get some help. And I think the more we keep normalizing that and talking about that and sharing those things, people will, see the need to get some help.
So what practical things every community member can do to help reduce violence?
I'm boots on the ground, right, with the community, and I'm able to do the work that I do because I have such a great support team and great leadership and management. But everyone is a villager in the community. We have to wear that hat. We have to be deliberate in knowing that if I'm living in this community, I play a part. The store owner, the bus driver, the cab person, the person that sits on your bench, you know their names. Everyone plays a part in the community. And building those relationships from growing up, you had the lady in the window telling your mother you was outside doing something bad. You build relationships and camaraderie through that. So then that's where that accountability comes in. The same way where an outreach worker is engaging what we call a participant, and we want to be in a kind of neutral space. Let's go get something to eat. So we create that safe, neutral space, and then we're able to have dialogue, as he said, normalizing these kind of conversations. And so that's a big thing in our community.
I think there's a few things practically you can do, like when you find organizations like SUV, volunteer, get the information, be present for your community. No one person can do everything, but everybody can intentionally do something. Find a need and provide that. A lot of young people just want to be heard, make a space to listen, and be less judgmental. Love on our young people in our community. Stop talking about they all crazy, they all bad. Sit down with them, learn, build relationships. Those are practical things you can do, right? And outside of that, with other organizations, once you volunteer, you can see how you can fit in different things.
Yeah, he said it best. Again, I think it's just breaking down what mentoring is, and us, I call all of us community investors, because we invest in our community. And investing isn't just monetarily. Investing is caring about your community, showing up, being there when you need it, right? So mentoring a young person is not that difficult. It's literally making sure that you say hello to that young man every single day. Making sure that he knows, listen, I'm here if you ever need to talk. You don't have to stop. It's just letting them know that you're there, right? So again, that's kind of the things that we're trying to bring to the communities. How can we stop this violence? It's just about caring, really.
And it all starts with relationships, and far too long we've had transactional relationships, right? We need transformative relationships. And to have a transformative relationship, we need three things to be present. We need trust, we need time, and then we need understanding, right? And that builds into your transformative relationship that we need in our community.
I think also, we talk a lot about adversity and all these violence and these negative things and the impact it has on people's psyche, people's physical and mental health. But one way to counter that, like negative experiences, with positive experiences,
Yes.
right? And counter that, as everybody here mentioned, is by really humanizing the other side, right? Seeing your fellow human being, your fellow community member, as just somebody else that's a living, breathing entity just like you, and seeing the importance of connectivity, right? And what we realized, the importance of connectivity in hope was really highlighted these first 2 weeks of June when the Knicks went on their run. The city was, it's true, the city was very different during that time period. There was a sense of hope, of connectivity. People were talking to strangers on the streets who were wearing a Knicks hat, camaraderie, and we saw it in the numbers, right? During the NBA Finals, our target areas had 0 shootings with SUV. We had 22% less victims of violent trauma coming to Jacoby during that time period compared to the same time period last year. So what does that tell us? It tells us that hope is infectious, right? Positive experiences are infectious. When people feel connected to something, when people feel positive, they are kind to each other.
I just seen that New York City is #1 on the list.
Yeah, it took the Knicks to hear that. That's a fact. And poverty.
So what role do schools, churches, community organizations, and hospitals play in preventing violence before it happens?
What were your first ones again?
What
Okay,
role
so-
do schools, churches, community organizations, and hospitals play in preventing violence?
I'll do schools and churches. So schools, and we're seeing it happen now, it's schools need to open up the place for us to go in and have conversations with these young people and identify, right? They're there with these young people every single day. They're seeing what we're not seeing, and a lot of times they're seeing what their parents aren't seeing, right? So again, a lot of the professionals there, if they're able to identify certain things and bring it to the attention of the parents, and not only parents, but those that are in the community that are trying to invest in them, that's one way. The churches, what they can do is just have safe spaces for young people to be, right? Not only young people, but for community members also, right? Maybe restorative justice practices, maybe conflict resolution. Having these safe spaces in these churches and having a kind of open door policy for them to come in and have that safe space is something that we need in our communities through our churches.
I'll piggyback on the end of that, being a pastor, right? So I'll take the heat. So pastors got to get out of the 4 walls. You got to get in that community. You got to reach the people, and you got to have Eddie just said, allow some way to have them come in, but you also have to go out. People don't care until they know you care. Get involved, all right? And you got to stop just saying we're going to pray over everything. Yeah, we're going to pray, but we need some practical actions as well, and we can't forget that through these ministries.
Similar to what Kwame said, physicians need to get out of their 4 walls of the hospital, right? And that doesn't just mean you have to get out physically, right? Yes, that's important, but create programming, hire people, put people in place that you know can do the work, can be extensions of the hospital for you. We can't do everything. I think not one of these sectors alone is going to be able to cure gun violence, but all of these sectors together, coming together, could really make a difference. I think our program is a testament to that, right? Of being able to put people in place from different sectors to come together, to get out there and do the work. And I think what we have to do as hospitals, as physicians, is to humble ourselves and to understand that we cannot cure everything alone. Not everything will be cured in the hospital. The best medicine is preventive medicine, right? The best medicine for this is not treating the patient that comes in with a gunshot wound, it's preventing that patient from ever even coming in.
It's just a little elaboration. All of those sectors are needed in the community. You know, we take a piece of every one of them and implement it into the community. It's necessary, whether the schools with the young people, whether the hospital with the victim. You know, I get passionate about the work because, again, as a victim of gun violence, I wish I had SUV when I was a victim. They play a role from the moment you are hurt to helping you triumph in life. Like, that consistency is so important. You need it at the school, you need the church, and of course the hospital. I need to pray. I want to learn what's happened with me physically. All of those entities are necessary. And to be a credible messenger, to be able to regurgitate that to the community, that, hey, we have that. We have help there for you. It's just such a blessing.
One more thing that we can't overlook, right, and all those, the schools, the church, all the other entities, is that you can't be ignorant to gun violence, right? So you have to get the information to share the information in all those different settings, right? So you want to bring in people to inform how to deal with anger, how to deal with conflict resolution, how to resolve things before they go to that level. So you have to get as much information to inform the students, parishioners, where second the hospitals, everything. They have to be educated on what's going on and what are the preventive measures, and then apply.
And again, it's just the same message. Again, it's the collaborative work that makes it successful, right? And we see a lot of words that we hear, the wraparound services, right? Wraparound services. What we're seeing is this wraparound community. We're coming together as a community. It's not about the service, but it's about the community coming together because we live here. We are part of that community. And if you guys are investing the way you say you are, churches, hospitals, schools, all coming together and wrapping that young person up, making sure that wherever one fails, the other one can pick up.
The service is the servant.
So we talk about, like, children, and of course, when children witness gun violence as a whole, they'll see it on TV, they'll see it on social media. How can parents start the conversation with their children after hearing about a shooting?
You know, I think there's something called adverse childhood experiences. And what these are is instances in a child's life where there's some adversity, there's some stress. What we know about these adverse childhood experiences is that the more adverse childhood experiences you have over time, there's a cumulative effect where it has a negative impact on your brain development, has a negative impact on your emotional development, and you're at higher risk for having issues with learning, issues with other psychiatric, psychological diseases later on in life, like depression, anxiety, things like that. So I think it's important to try to limit the exposure as much as you can, both in social media, TV, things like that, in the community as much as you can. And if you live in a neighborhood, in a community where there is a lot of that, it's just talking to your child about it. You'd be surprised how much they understand and how much they internalize and don't say it. And it's okay to say it, and it's okay to talk to them about it. It's okay to reassure them that they are safe with you, and that they are okay. Things are happening, some things are out of our control, but you are okay. You're okay with me, we are safe, and teaching them about being safe as well once they're out on the streets on their own, right? It's not an easy task to do. But I also think, like I said earlier, to counter these adverse childhood experiences is to have positive childhood experiences, right? Is to go out to the community to do positive things. Is to go out to the park, to go out to the summer sprinkler park that's local. Go out to eat at the local neighborhood restaurant, right? To teach them that it is okay to be outside. It's okay to be part of your community in a positive light.
Doc said it perfect. Creating a safe space for them is the most important thing. And having those conversations and letting them know that they'll always be safe with you, to come and to speak to you and to let you know how they feel and what they're going through. And again, as a father, and I'm here with 3 other fathers, we live by example each and every day. The way we react to conflict in our own lives, the way we speak to them at the end of the day, how they went through any conflict they went that they give advice. But again, it's just being that example for your child, so how to carry themselves and how to deal with traumatic experiences.
Yeah, I agree. It's really being present, listening, nurturing, and Doc touched on ACEs, which is really a big effect in our community. They have something called PTSD, persistent traumatic stressful environments, and that's where most of us grow up in. And being able to identify those areas and explain them and try to do what we can to get past those different areas in our environment with our youth, but really listening to them, right? Being present, listening, and really not just listening and not doing anything about it, but really trying to figure out best solutions. Yeah.
So, how do we help friends who've gone through violence?
I think in multiple ways. I think a lot of the answers to questions are kind of like similar, right? Being present, being there for them, listening to them, creating spaces where they can feel safe, doing the homework, doing the research to see if there's other resources, being supportive, being a voice of reason, right? Because you have a friend that might have been affected by gun violence, and now on his mind is how are people looking at him, right? He comes from a time where maybe he was involved in different things, and now he wants to go back to that mindset, or never been there, but now feels he has to go that way, right? So being a voice of reason, giving them an out, showing them a different way, showing them that they have purpose, showing them the future, like, where you can go. So those are some of the things you want to pour into your friends when they get all these different things, right? And be real. Don't make up things, be real. Have real dialogue with them. So those are some of the ways.
Yeah, exactly. It's just about validating their feelings, right? You're working with people, you're talking to people every single day. And again, we're talking about friends. If it's a friend, again, we're talking about safe spaces. That safe space for that friend at that moment is just that, hearing them out, letting them say whatever they want to say, and giving them that free range. At the end of it, you follow up with them and you talk to them and you let them know how you're feeling, that you understand how they're feeling, again, validating how they feel. But again, it's just having those conversations and keeping it open so they're able to do that, and knowing that you're not going to judge them, right? You're not going to judge what they're saying. You're a safe space for them at that moment, and you know that.
They said it. For me, it's being honest and active listening, but also referring, let them know that, hey, seeing a professional is okay. Normalizing the conversation, because what happens especially where we come from, is people will be that active listener and listen, but then they're absorbing that trauma. They're absorbing all of those feelings, and now their cup is running over with this, and they don't know what to do with it. So I encourage when especially dealing with family, like, hey, this is what I did. This worked for me. And seeking a professional, you can share everything. Sometimes you hold back on your words because you want to let it out, but you don't, so a professional is always great. So referring out is something that I encourage.
I've got to echo that, because sometimes we miss that. Being able to tell the person, hey, I'm not an attorney. I'm not a therapist. I'm not a doctor. I'm not, you can go get professional help. We had to learn that here at SUV, that we're not social workers, right? But we have social workers that can help you, right? Sometimes stepping out of a role that you don't belong in and putting the right person there, right? A warm handoff. Hey, this is a professional social worker. They are trained for this. Here you go.
They get heavy out there.
Yeah.
So I know for me, I had a conversation with my daughter, and she looked at me and she said, "Ma, when do you know when it's time to seek professional counseling?" And having that discussion where I opened up and I explained my own personal experiences as to why seeking professional help is important. So when should someone seek professional help?
I think what was mentioned was when you feel like your cup is running dry. And I think there are multiple ways in which that manifests. I think in different people, it shows differently. In some people, it shows just complete fatigue and disregard or disconnectedness, or you're just feeling like you just can't do certain things anymore that you used to do. Or it may be that you're just easily triggered by things, right? You easily get upset over simple stuff, whether it be at home or at work, or there are thoughts that you just cannot shake, right? There are some things that come back either from your past or from your current experience, or perhaps something happens now that brings you back to another place a while back that resurfaces a lot of feelings. And I think, as has been mentioned before, like, look, you have 4 men of color up here who are openly admitting that it's okay to get help, and it's okay to not be well. It's okay to not be okay. We understand that in our Hispanic and Black communities, it's very much a stigma, especially for men to talk about it, especially for men to express themselves. We have a huge problem in this country of men not having relationships with each other anymore, men not connecting with each other, men not expressing themselves, not maintaining friendships, because we're so caught up with work or doing whatever we gotta do, we lose sight of the fact that we still need friendships. We still need to check on each other. We still need to check in on people. How are you? How are you doing? How's it going? I haven't seen you in a while. Let's go grab dinner. Let's go to a game. We don't do that enough. And I think part of checking in, it doesn't have to be, quote unquote, a therapy session with your friend. It's just checking in. Let's go play ball. Let's go for a walk. Let's go watch a movie. Let's go watch this game together, right? It's just simple things like that can make a difference.
I think another preventative measure I think we have to start doing in our families, in our communities, that I don't think we traditionally were raised on, is teaching what is available before it's needed. So they have communities and families that will teach what attorney is necessary before you need it. So you know, if you're in this situation, I need to call my attorney. Or you have a private physician that knows if anything that you disagree, you go. We need to teach that with therapy as well. If you're going through things, these are the things that therapy can help you with. These are the things that if you're feeling this before it's necessary, and we make that something normalized in our community, they will know where to go. Right? But far too long, we don't express those things until it's, the last resort. And even then, it's like, maybe so we start teaching, why is therapy necessary? Why is an attorney necessary? Why is a doctor necessary? Why is these different things necessary? They will know instinctively when they feel a certain emotion, I need to see a therapist. So I think we need to start normalizing that more.
I think we got a cheat sheet. We're looking at each other's What I was going to say was exactly that. And the way I was going to put it is, I'm a father of, like I said, 4. I have 3 young boys under 8. I make sure I make their PCP appointment. That comes every 6 months. I make sure I make their dentist appointment. I make sure I make their eye appointment, right? Why isn't therapy a part of those things that I do for my children? I don't realize. Why is that not something that I start normalizing as a child? So they know that whenever something comes up, it could become part of their everyday life, that they're able to express themselves, talk about it, and let it out. So it doesn't have to be resisted. So that's what we need to do as a society, as a community.
And I just wanted to add that as someone who's like boots on the ground and doesn't have a lot of that educational background, I'll be unaware sometimes. What we do with the work that we do is we get on the ball, we shout out to the community, hey, we have these resources. Hey, we share our testimonies and how it helped us. So not being able to identify, and it's a real life situation. I had a guy who watched us for months and was like, yo, I love what y'all doing. Okay, fam, let's introduce him. And he lives in the community, didn't even know so many new faces. And he said, hearing what you guys do and what you guys offer, and a lot on my plate, man, I definitely need somebody to talk to. And hearing you guys have those resources, and then I've been watching some of y'all, like just to see that, and it's like, yo, well, I really appreciate that. And hopefully you stand tall when you was watching us. And whatever we can do to connect you to the help that you need, we got you. So sometimes you don't know. Sometimes it's just regurgitating that information consistently and someone finally saying, okay, there is a source, let me grab onto it.
So I'll read a statement and you can tell us whether it's true or false, and if you can you also elaborate. Gun violence only affects people directly involved.
Oh.
Unequivocally false. I think there is a domino effect when a single shot is fired. And it doesn't only affect the person firing it and the person that lands on. It affects everyone around that individual. It affects that individual's, both those families, by the way. The parents, siblings, their children, their cousins, their aunts, their uncles, their close friends, their distant friends, even as simple as a person that owns a shop where they usually go to get breakfast. Like, everybody is affected, including the people that take care of that patient, by the way, including the physicians, the nurses, the hospital responders, the outreach workers. It is a domino effect. Everybody carries a piece of that gunshot the moment it's fired. That bullet is carried by hundreds, if not thousands, of individuals. It is indeed a ricochet and domino effect. And it's why it's so important that we prevent it. And it's why the work that these men sitting here with you do is so critical. Because every single bullet that doesn't leave a gun does not touch those hundreds of individuals. Let you go first.
And the other side that we don't are comfortable to talk about as a community is it also affects the other side of the perpetrator, the one that caused the violence. And if that person does get arrested, how that affects their whole family and their whole community. Again, it's both sides of the gun that are affected whenever we have a victim of gun violence.
And then when we look at it from a financial standpoint, every shooting right now is estimated about $600,000 come out of the community. A person injured, not a homicide. A homicide is over $1 million. That comes out of that. It's up to 3.8.
Yes.
That comes out of the community, right? So it affects everybody. That's funds that can be going into developing the community, fixing up the community that's leaving your community. And unfortunately, when that individual is murdered, it just killed everything that will come from it. So to me, every homicide is a mass shooting. You cut off everything that would ever come from that individual.
And just elaborate again on the generational effect of it. Is a kid not born today? There was a shooting that took place. In 15 years, when he's born, he gonna be holding a gun, shooting somebody for that same beef. So that domino effect, that snowball effect that I was talking about before, from that one shooting that happened today, in 30 years, someone's gonna be a victim behind this. Like I said,
And our goal is to keep spreading that information so that that doesn't continue to happen. Keep shining the light on those situations.
Children who witness violence usually just move on.
False.
you triggering me.
So we are, I think you're doing this on purpose. Everything from fear to feeling inadequate to feelings of guilt as a young person, right? Not being there. We have dealt with, unfortunately, the deaths that young people have witnessed from adults in their lives, from friends in their lives, from siblings that they have seen die before them, or they just died while they were living with them. It affects them every single day and affects them for the rest of their lives. And again, this is something that it shows up in different ways because that grieving process can be different for each and every person. And again, that's why we're dealing with some of that a lot of the violence that we're seeing is a result of some grief.
The excuse I have.
Not only is there evidence to the point that, there's, like you mentioned about adverse childhood experiences and the impact that it has on people's physical and mental health, things like acute stress disorder, post-traumatic stress disorder. And what we're trying to do now on the inpatient setting here is trying to intervene early. We screen every single patient of not just violent trauma, but any trauma, any child that comes in, we screen them for acute stress disorder, PTSD. Because we know that if they have symptoms, if they're positive on a validated scale, if we get them connected to therapy and treatment right away, at discharge, they will not progress to PTSD. and that is the goal. Every child carries that with them. I think I probably speak for a lot of us that are sitting here right now that we probably experienced some form of community violence as a child that has impacted us now. And I think what we've learned to do is use that in a positive light to now be part of this type of program, right? Is use that type of trauma to be able to prevent that trauma from happening to somebody else. So in short, I think children carry these feelings and these memories into adulthood, and it definitely informs their future behavior.
Trauma always shows up immediately.
No, as I mentioned, acute stress disorder and can progress to post-traumatic stress disorder, and that can pop up at any time. It's not just what the DSM-5 says from diagnostic criteria of 3 months afterwards. Like, no, it can happen years, it can happen decades later. There's a lot of adults walking around with a lot of unresolved trauma that they never dealt with. And I think we have to look within ourselves as adults, as Eddie mentioned, as fathers, as mothers, to deal with our own inherent trauma so we don't pass it on to our children.
Say the question all the time.
The trauma always shows up immediately.
No. Again, as someone who's been a victim of gun violence and now doing this work, there's times where I'm triggered in the work where I have to tap out. Shout out to SUV who gives us these resources too, to make sure you're able to check in on yourself so you can best service the community. Shout out to Dr. Rodriguez. They give us those services to be able to speak to someone if the load becomes too heavy, if we ourselves need to talk on a personal level. So no, man, no, we need that help. We need that support.
So, no, it doesn't show up right away. And I'll just speak from experience myself. I've been working with Jacoby SUV. This is my 8th year. And through my time here, I have identified the body of a participant. I have been in the room when we're having the conversation of a friend of mine that was shot and killed about their organ donation. I had to sit in a room with a mother whose child was just taken away, or husband was taken away, and hearing those screams. And again, part of the work is just keep it moving, helping the situation the best you can, right? But these are things that in my own life creep up at any different time. It could be in the middle of the day, it could be at night, where I'll break down, right, and not understand why, but I do. All right, because again, it's not normal. This that we live through and that we address every single day is not normal behavior. It's not normal things that we should go through as a society. And my job is to go out there and echo this to the community, but I also deal with it.
Talking about mental health makes people weaker.
Makes people what?
Weaker.
No. Again, you see this bright smile? It's because I sought out the help. I was able to learn how to be the best version of myself. I was able to learn how to go through it, because you don't get over it, you have to go through it. And again, it's helped me out just so tremendously with having someone to be able to talk to about things. Not only to talk to about things, but to help me identify what the root cause of these issues are. We always reverberate back and say, talking about our childhood, but those things are important, especially in a safe space where you're able to share that kind of dialogue with someone who's not going to hold you accountable, who's not going to judge you. That's so big where we come from. One thing when we start this work, you're challenged because your community want to hold you accountable for things you did when you were 16, but you have to continuously show them that you're walking this walk, you're changed. You're no longer that individual, if you were terrorizing your community, and telling them what you did. And again, seeking that professional help, having those professional resources is what allowed me to be that best version of myself. So, yeah.
So speaking of SUV, can you tell us about the Stand Up to Violence program and how it helps interrupt violence before it escalates?
So what we do at SUV is we work to We mediate conflicts, working with people at the highest risk of getting shot and doing a shooting. And we're able to do that by building relationships, by using motivational interviewing, by being boots on the ground. As I said, credible messengers, individuals come from those same communities who might have had certain past, who've gotten that help and are now back in the community, letting them know, hey, this help has helped me, and I want these same things for you. So.
So, that's our spokesperson.
Well, also, though, we got to add to that, because when me and Doc first started, one of the key things that we didn't have was case managers and social workers. So now, not only can we help the participants, the ones that's directly affected by, the highest risk to shoot somebody or be shot, but now we can also deal with the families and the community in a whole. So that's something that we are very proud of.
I think along with that is the expansion of our hospital-based approach, right? It's being able to extend, like Kwame said, with more supportive services in place, with more social workers, case managers, to better support our patients. And I think what we were most proud of is that our program has grown in accordance with the need, right? So when we see a need, when we see a gap, we address it. We get funding, we address it. We're always growing. We're not perfect. We're still in constant motion of trying to meet the need, because unfortunately there is an increasing need. So I think we always have to grow, and we always have to fulfill needs that present us.
So if someone is watching today, knows a young person who may be at risk, what resources are available?
So we have different resources, depends on what that young person is ready to do in their lives, right? Again, our program has grown in the way where we have employment specialists on staff. So if you need some type of job, if that's what's deterring you from changing your life, then we have the opportunity. We have case managers that, again, will wrap around any type of services that you may need, maybe for yourself or for your family, to help you be successful in life. We also have different partners in the community. So again, we're not the end all and be all of everything, right? We understand that, there may be other suitable programs in your own community that can help you. How do we support you with that, right? How do we follow up, making sure that once we make that referral to that other program, we're able to still be there for you by following up and making sure that you're getting what you need, right? So there's different ways that we're able to tackle that.
And one of them is sitting at the table, that orange shirt on, right? So we have our credible messengers that really build relationships. They have what we call RAP sessions. We deal with relationship, agency, aspiration, and purpose. So having those meetings and mentoring them and giving them ways out of going to the lengths of getting the gun and pulling the trigger. So we rely heavily on our outreach team out there in the field.
And I just wanted to add, sometimes we use non-traditional resources. So for instance, I come from, you want to do music, you want to rap, you might have access to a studio. We build that relationship, say, hey, the guy let you rap, as long as you're not shooting or smoking on nobody dead, or you're not saying anyone's going to die in this song. So we give you the next. You might want to paint. We have access to painters. Like, there's anything you want to get involved in, we can help assist you with. But as my program manager said, you got to be serious. We meet you right where you are. You take a step towards us, we're going to take 2 steps towards you. But you have to be serious. We don't want to waste anyone's time when we meet you right where you are. So if we identify that you might need some mental health help, we're going to push that. Like, hey, I did this. This would happen. Can I introduce you to this person? So we do some non-traditional things sometimes as a credible messenger to help our participants.
I was always that person that there was a woman I long ago that her motto was, we don't kick children out, we kick them in. Mm-hmm. So that's always stuck with me. And even with my children, I tell them, I don't kick you out, I kick you in.
We don't quit. We don't quit.
Right.
I got kicked out.
Now my mama let me back. I ran away.
So despite everything we hear in the news, you've seen incredible stories of hope. Can you share a story that reminds us healing is possible?
There's so many stories, and I don't want to keep putting on a shirt and like.
So again, we're blessed to sit in a room with what we see every day. We're blessed to be able to hire community investors, credible messengers that live in the communities that they serve, right? So it's part of their story, it's part of their life, it's part of their family. So we're watching it every single day. People that have truly transformed their lives and are going back into the communities to be that change and to be that hope, right? And recognizing the difficulty of that. One of the mantras that we use is it's like I'm asking an alcoholic to work in a bar. That's essentially what we're doing. We're hiring people that have worked truly hard to get away from the street aspect, to get away from the violence in the community. Now we're asking them to go into it, back into it, not into it in a way where you're gonna be doing the violence, but now trying to get and change the lives of those young men that maybe you have influenced to do this violence today because of the fame that you have done in your own community. So again, I see it every single day. We have a staff of over 30 purple messengers that have truly changed their lives around, that are making their lives work to go back into the community to make that change.
And just to add to what Eddie is saying, while doing the work, we've witnessed participants, which is the highest recidivism, most likely to shoot someone, be shot. That was in the middle of heavy conflict, right? Perpetrators of violence become participants and watch the transition from them growing through the program, making better decisions, stop being impulsive, calling the outreach worker, say, where you at? I need to talk to you because this is what I'm feeling. To the point of going through that process of it to becoming inroad to becoming actually working with us. We have people on our staff that we've seen that transition over the years, so we know there's hope to change, right? And we have so many different examples of that. You know, not just the ones that we hired that already have made the change before they came in, but we've seen the process in real time.
Right. So I'll just close with one question. What's one message you want every young person to hear today?
It's okay to be different. It's okay to be outspoken. Your voice should be heard, and your voice is important in every room you go into. Right. So that's the biggest message I have, again, because we can have as many programs out here, we can have as many ideas as adults, but at the end of the day, they're in it every single day. They're living in the schools, they're living in the communities that we're talking about, and they're dealing with what we're trying to work against, but they're in it every day. So again, just using your voice, being outspoken, don't be afraid. When you see something that bothers you, speak up against it. That's all.
I heard a quote from the late Miles Monroe, and he pretty much just said that we all created on purpose with a purpose. And I like to tell young people, don't give up, always look up, look ahead. No matter how long it might take, look, we are next to NBA champions. That's right. It took us 53 years, but we did it, right? But always be encouraged to press forward, fail forward, look ahead, don't give up, and find someone you can trust, right? So you can build a relationship to be better.
I think it's just the idea that everything and everyone is connected. I think if you just embrace that idea that literally everything around us and every single person that you encounter is connected to you in some way, you will be less likely to hurt that other person. Right? If you see that person for who they are somebody's brother, somebody's sister, somebody's son, somebody's father, somebody's mother, you will respect that person for the incredible thing that they are.
I just tell them that their life matters. You matter, your life matters. You know, wake up every day like the Dallas Cowboys start their season, motivated and inspired to take on new challenges.
Yeah, that's the Cowboys. I don't know where that came from.
Just what you were saying. We're not going to take that one.
Can we cut that from the
Room for the Giants.
So as we close today's conversation, remember this. Preventing violence isn't just the responsibility of hospitals or law enforcement. It's something we all have a role in. Together, we can create a safer neighborhood by supporting one another, investing in our youth, speaking up, and making sure those affected by violence know they are not alone. If you or someone you know needs support, please reach out. Help is available and healing is possible. Thank you to our incredible panelists and to everyone who joined us today. Please share this video with your families, with your friends to continue this important conversation. Follow us at New York City Health and Hospitals Jacoby North Central on Facebook, Instagram, LinkedIn, and X for any upcoming events, health information, and community resources. Stay safe, stay connected, and thank you for watching. Take care.
Thank you so much.